it's my privilege to introduce to you another great friend. As I may have mentioned to you, Amy, when I got accepted to medical school, my father, who was a brilliant physician, sadly, he passed away from cancer 10 years ago. He said, I'm only giving you two pieces of advice, Joe. He said, number one, God made you with two ears and one mouth to listen more than you speak. And that was pretty impressive coming from a urologist. I'm not sure the urologists do a lot of listening when they're down there, but nonetheless, he modeled that. And he said, number two, treat nurses like the professionals they are. And so we learn a lot in medicine from our nursing colleagues. And Amy, you have been such a voice for the myeloma community and for the nursing community. And we've asked you today to cover a really important and beautiful topic, which is communication. Very often, no matter what our background is, we have difficulty communicating with our healthcare team, and yet we know how important it is. So I'm going to turn to you to walk us through this notion of communicating with your healthcare team, a two-way, hopefully not a single one-way, but a two-way street. So I'll turn it to you, my friend.
Thank you so much. What an amazing introduction. Thank you so much, Dr. McHale. It's a pleasure to be here. As Dr. McHale said, I'm Amy Pierre. I'm a senior clinical director at Flatiron Health and a nurse practitioner at the Myeloma Lymphoma Division at Memorial Sloan Kettering, and I'm a proud member of the International Myeloma Foundation's Nurse Leadership Board. And just like Dr. McHale said, I'm going to review some key concepts today, including participating in your healthcare actively, signs and symptoms of myeloma and risk factors. We talked a little bit about that today, but I'm going to do a deeper dive, and some side effects of treatment and how to prevent and manage them, and how to effectively communicate with your healthcare team. So how is myeloma typically diagnosed? How do we know how to look for it in patients? Well, there's really three avenues in how myeloma is discovered. So patients could be going in for their routine checkup, and upon checking routine lab work, such as complete blood counts and a chemistry panel, abnormal labs that are revealed could be suspicious for myeloma, or it could be early, meaning that the patient may not have any symptoms at all, or it may fall into the sort of second possible scenario where a patient is seeing their provider for evaluation and management of a specific symptom. They could have increasing fatigue or bone pain, or just generally not feeling well. And labs could reveal some abnormalities, but pain may prompt further workup, such as imaging, like an X-ray. So both of these situations, because patients have mild or no symptoms at all, usually aren't emergency situations and are first discussed and evaluated in the office. So there's time to understand what is being evaluated. The third scenario is more emergent, as a patient's quite sick and symptomatic, can require an ER visit. And this is when we find issues that require inpatient management, like kidney failure or bone fractures that could be compromising important parts of the body, such as the spinal cord. So it's really important to understand that myeloma can be discovered incidentally, or when someone has mild symptoms, or of course, when there's such a high level of myeloma that we now have an emergency situation. I really love doing these programs because they're all patient-centered and designed to empower the patient to advocate for themselves by actively participating in their myeloma care. And we want our patients to partner with us. We are working together as a team to battle your myeloma. It takes a village to take care of myeloma. And although your life may be filled with appointments as a patient, they're for a reason. It's a multidisciplinary approach and everyone really plays a role. So to take charge of your care, you have to know who your healthcare team is. Get familiar with their roles. Once you know who's part of your entire healthcare team, you can then have sound input on your treatment and disease. So your primary care physician is important. Please don't leave them out. A lot of patients start trimming down their provider list, and their PCP sometimes gets left behind because you see your myeloma team so often. But you need your primary care physician. Your PCP monitors your blood pressure, cholesterol panel, your general health care from head to toe, because your myeloma specialist or your oncologist can't really do everything. And understand the difference between your oncologist and your subspecialists. For example, you might have a kidney doctor, or a nephrologist, or a cardiologist, or an orthopedic specialist. Understand how they interrelate. You may have a myeloma specialist, someone who just takes care only of patients who have myeloma, or you might have a general oncologist who takes care of all different types of cancers, and they may work together to tackle your myeloma. But having a myeloma specialist in your care is really important. And I saw someone had asked this question in our panel. So having a provider who specializes in myeloma, or a provider who has sort of a high volume of myeloma patients driving your care or even involved in your care is important, because many studies have shown that patients who receive care by a myeloma specialist or someone who treats a lot of myeloma patients do have better outcomes. And all the additional healthcare providers on your team, such as your allied healthcare staff, find out who these people are and what they do. Understand the difference between a nurse practitioner like myself and a nurse, or understanding the difference between your office practice nurse, your infusion nurse, your research nurse, all their specific roles in your care. There could be surgical and radiation oncologists, social workers, dietitian, pain specialists, pharmacists. The list can be massive. And of course, don't forget your family and your caregivers and your support network. They're the important eyes and ears and can advocate for you. It's really an important question to ask who someone is on your care team, and it's an appropriate question to ask what their role is in your medical care. And I can't underscore enough that knowledge really is power. Ask questions about your labs. What are the markers that they're following for your disease, and participate in key decision points? Because your questions help us guide the conversation and helps us understand what's important to you and where we need to focus on visits. So what are some questions that you should be asking your healthcare team to understand your risk? Know your family history. A lot of families may not go in depth about the medical history of their family and may not know the details, but it's important to ask. It's also important to know the risk factors of myeloma. And by risk factors, I mean we know that myeloma occurs more commonly in patients who are Black, the male gender, older people, and also people who are overweight or obese, and know the symptoms. I always tell my patient, no one knows their body better than themselves. So if you have a new symptom that's concerning to you, something that's lingering, listen to your gut, go check it out. The two most common symptoms of myeloma are lab abnormalities, such as being anemic, which can make you feel tired or even short of breath, and also bone pain. In the back, in the ribs, the arms, legs, really anywhere. And if you're being treated for myeloma, talk about how you're feeling to see if you're experiencing side effects from treatment that we can help you with. Feel free to ask questions about your test results your team conducts, so you understand the results and what they mean, and really what is clinically significant. Because we run a lot of blood work, and we want you to focus on the most important labs that we draw. And ask about treatment. While you're on the treatment that you're on, make sure it's the best individualized plan for you, and also what other option that you might have. So sometimes patients arrive at their appointments and they're so overwhelmed with what their provider has said that they forget to ask their questions, or they don't even know what the questions to ask. So we want you to help you get the information that you need and get the most of your appointment. So this myeloma treatment discussion tool was designed to keep the patient in the forefront and understand the patient's preferences and allow the patient to be an active participant in their care. It was created in collaboration with myeloma patients, caregivers, myeloma support group leaders, and my colleagues at the IMF Nurse Leadership Board. So ask important questions such as, what can I expect now and what can I expect in the future? And ask these questions not once, but many times. Have these important conversations when treatment is no longer effective, or if you're switching to new therapy, or whenever you have an important life change, or when your priorities and goals have shifted. Talk to us. Tell us what is on your mind so we can best support you, because having myeloma is hard, and that's not lost on us as your providers. So here's a closer look at our communication tool with questions to ask your team. So these are all yes or no questions, such as, it's important for me to understand my treatment plan. I prefer the most aggressive approach to treat my cancer. Or, I prefer the least amount of pills to control my cancer. Quality of life is important to me, more so than quantity of life. These are all really thought-provoking questions that you should ask yourself and share with your provider. They're designed to prompt you to ascertain what's important to you and in your medical care, and have you actively engage and a willing participant in your myeloma care. So let's talk about symptoms and side effects a bit more and why they occur, because both myeloma itself and treatment can cause side effects. So for example, myeloma cells can cause bone fragility, make you more susceptible to fractures, causing bone pain. And this widespread bone destruction can cause calcium to leach into the bloodstream, raising calcium levels, which can make patients sometimes feel confused, constipated, or even nauseous. And these myeloma cells divide and they crowd out normal cells in the bone marrow, resulting in anemia that causes fatigue or shortness of breath, as I talked about, weakness, or sometimes even feeling lightheaded. And overproduction of the myeloma antibody suppresses normal antibody function. Therefore, your immune system can be compromised, leading to increased risk of infections. And myeloma proteins can affect kidney function. But tricky enough, Symptoms can come from myeloma cells or from treatment itself, and sometimes it can overlap. For example, anemia, we know can be from the myeloma itself or from treatment. And peripheral neuropathy, which is damage to the nerves, can be related to the myeloma itself or treatments. So be aware of the symptoms that are listed on this slide and side effects. The key for side effect management is knowing the source, maximizing prevention, and managing the symptoms. So let's talk about the drug that everybody loves to hate, steroids. So remember, almost all therapies work better in combination with steroids. And some of the steroids we use are dexamethasone, prednisone, methylprednisolone, as Dr. Usmani showed earlier. They're important, but can be tough drugs to tolerate as they can affect every single system in the body. For example, it can cause irritability, mood swings, it can affect your eyes, can make you flush, sweat, stomach discomfort, fluid retention, weight gain, increased risk of infection, muscle cramping or muscle weakness, and can really push people into full-blown diabetes if they're borderline diabetic. So you can see from this picture, it really affects pretty much every organ system. And for patients who are on long-term therapy, for example, patients who are on that combination therapy of daratumumab, lenalidomide, dexamethasone, a lot of myeloma physicians are only dosing the dexamethasone on days of your infusion to help avoid some of these long-term toxicities after cycle 9 or so. And there was a study that was published in Blood that switching select older patients to a lower dose of lenalidomide and discontinuing dex after 9 months was not only safe, but also yielded similar outcomes compared with patients who received continuous lenalidomide and dexamethasone. So to actively manage some of these side effects, make sure you take your steroids with food to help protect that stomach, and usually need to be on some sort of proton pump inhibitor and acid, and sometimes antimicrobials to prevent specific types of infection that occur in people who are profoundly or chronically immunosuppressed. And not every administration time works for every patient. I have some patients who like to take it in the morning because it gives them pep during the day. I have some patients that like to take it before they go to bed because that sort of surge in energy happens when they get up really early in the morning for work. So it's different for everybody. Let's talk about some GI symptoms. We know our myeloma therapies can cause GI toxicity, such as diarrhea or constipation, and then maybe sometimes patients fluctuate between both of those side effects. So diarrhea can be caused by certain medications, laxatives, antibiotics, some supplements. It's important to drink lots of fluids when you have diarrhea and have myeloma itself to keep those kidneys nourished. Avoid caffeinated beverages, that dries you out. Heavily sugared beverages do that as well. Take anti-diarrheal medications like Imodium, maybe Lamodal. Fiber is really good to help bind that stool. And if you have diarrhea that's really sort of refractory to anti-diarrheals, you can try Welchol. We know that lenalidomide-induced diarrhea can be helped with Welchol, which is a bile acid sequestrant. Constipation can be caused by some drugs as well, like opioids or some supplements. Fiber is good for constipation too. And also fluid intake is really important to help with constipation as well, because it's good to help with the fiber as well. So let's talk a little bit about clots. So deep vein thrombosis, also known as DVT, and pulmonary embolism, also known as PE, are clotting problems that we take very seriously. And there's risk factors for developing these clots, such as having a personal history of developing a clot or family history, being really sedentary. Even certain surgeries can do it, certain medications like carfilzomib, the immunomodulatory drugs in combination with steroids. And symptoms could be swelling in your legs, asymmetrical swelling, or a dull ache in one leg, or change in the color of the leg, such as redness. Sometimes the clot can travel and cause a pulmonary embolism. So you can have chest pain or chest tightness. That can even manifest as just a rapid heart rate or feeling anxious. So the best way to combat this is to prevent it. We know which drugs can predispose your risk for developing a clot. And there's a lot of tools that we can use to help calculate your risk of developing a clot. So we may give you a blood thinner to help prevent the clot, or full-blown anticoagulant. And then lifestyle management is important too. Make sure you're getting up, walking, moving, particularly if you're going on a flight, get up or pump those legs a little bit, because we know being sedentary is a big risk factor for developing a clot. So peripheral neuropathy, we know this is a really frustrating side effect for patients. It's damage to the nerve and can manifest as numbness, tingling, or pain, prickling sensation. I have patients tell me that it feels like they're walking on rocks or they're wearing socks and they're not. So it's an altered sensation in your feet or hands. And if you're ever we're going to ask you about this constantly because we know the best way to manage this is to prevent it from happening. So there's certain drugs that can predispose this side effects, such as bortezomib, and some of the immunomodulatory drugs like thalidomide. So we know that dosing bortezomib once weekly versus twice weekly can lessen the side effect. Also giving bortezomib as a subcutaneous injection versus an intravenous infusion. And there's some supplements you can try. There's some anecdotal information from the Dana-Farber Cancer Institute about B-complex vitamins with folic acid. There's certain medications we can try that directly help the nerve with nerve damage or nerve pain, such as some antidepressants. But if your peripheral neuropathy is really prominent, we may hold your drugs, alternate dosing, maybe switch to something else, and maybe even suggest seeing a neurologist for additional help with that neuropathy. So emotional side effects from myeloma or myeloma itself should not be forgotten. This can truly influence every aspect of a patient and a caregiver's life. So fatigue, depression, anxiety can affect your quality of life and relationships and can have many sources, including pain, abnormal lab values, being sedentary, not sleeping well, toxicity from treatment, low blood counts, and even financial concerns or worry about prognosis or changes in sort of your social behaviors or even sexual function. That can all affect your mood. So we know the best way to manage this is exercise, good quality rest, having a good support network, even sort of other alternative ways that can be beneficial for many patients, such as being mindful, meditation, spiritual, faith-based opportunities, certain medications such as anti-anxiety medications, antidepressants, drugs that can help you with good quality sleep, and even massages, aromatherapy, acupuncture. There's various ways we can tackle this, and sometimes it's a multi-modality approach. But we know that this is common, right? 70% of patients experience fatigue, but only a fraction of those patients actually let us know that they're fatigued. So please let us know what we can do to help you with low energy levels or emotional toxicity, because there are a variety of ways to manage this. And we know that infection prevention has always been important for myeloma patients, but now more than ever, given the state of the current world with the pandemic. And the reason why it's so important is that we know that myeloma patients are 7 times more likely to be infected than the general population due to their myeloma, but they also have a delayed recovery and infection. And this compromised immune system can be a result of not just the myeloma, but also from treatment. So how to prevent this is good personal hand hygiene, avoiding sick contacts, good oral care, washing your hands well, avoiding crowds. And sometimes we may use medication to help boost your low immunity levels or your low white blood cell counts, such as Neupogen injections or pegfilgrastim injections. And we know immunizations are important. We don't want you to get live vaccines, but immunizations such as your flu vaccine, your pneumococcal vaccine, your COVID vaccine, and boosters are all very important to protect you against infections. And sometimes we may need to treat you with antimicrobials, such as antivirals, certain myeloma medications, such as the proteasome inhibitors, even some of the monoclonal antibodies can increase your risk of developing shingles. So we may give you antiviral medication to help prevent that. And it's key to stay on that. Even if you get the Zoster vaccine, there are studies that show that only about 68% of patients after stem cell transplant were able to sort of have a mounted response to the Zoster vaccine. So it's really important to stay on your antivirals. And remember, if you're feeling unwell and sort of showing signs and symptoms of an infection, such as a fever, shaking chills, dizziness, short of breath, make sure you tell your team this could be an emergency and we need to evaluate you as fast as possible to make sure there's no infection on board. So financial toxicity, this is not a physical symptom, but can be a real compromising side effect from treatment. And a high burden of cost of care can come from a myriad of things, including high premiums, co-pays, travel expenses. Have we all seen the cost of gas lately? Even supplies from your medical care, cost of prescriptions, and possibly loss of income due to the inability to work or missing work because of frequent appointments. And let's not forget your caregivers, right? That person may now have missed work because they're caring for their loved one with myeloma. It's important for patients to understand that they're not alone in this. There's resources out there to help you with the cost of care. Talk to your medical team to see if they can point you in the right direction. It could be a social worker, a financial navigator in your office, or financial assistant team at your medical center. There could be payment plans that they could tell you about, or nonprofit organizations that can assist. And even pharmaceutical companies have copay assistance programs as well. So prepare yourself each visit with questions. Ask yourself really what's important to you. How effective is this treatment? What is the quality of life? How will it be affected? What are the risks? What are the benefits? What are the side effects? What are my alternatives, if any? Write your questions down before your appointment and bring them in and take notes. Now, if you're unable to take notes or you don't want to, appoint a friend or family member to be your appointment secretary, to take notes and be a second pair of eyes and ears for you. And sometimes these conversations can be complex and layered, and you may need time to think about it. That's okay. Ask if you could have some time to mull it over, and never stop learning. We're so fortunate that the treatment landscape for myeloma is rapidly changing year by year. And so never stop learning about myeloma and what's the latest and greatest in myeloma care. Always go to reputable sources like the IMF and ask your team for additional reputable sources of information to learn about myeloma. And speaking about the IMF, we have many, many, many resources to help you. From our medication pamphlets, these pamphlets give you all you need to know about facts about treatment you're on, to webinars and virtual programs like Empower. Our website, myeloma.org, which has comprehensive information about myeloma. Our support groups that are located all across the country. Our myeloma TV series with Dr. Dury, which are so popular and fabulous. He just breaks out all the information you need to know from the latest myeloma conferences, our new treatments that have just been approved. And of course, we have our myeloma info line that Dr. McHale talked about. It's essentially phoning a friend on myeloma. They're there to answer your questions that you have during the day, which is a wonderful resource as they eat, breathe, and live all things myeloma day in and day out. So I've provided you with a lot of information today. I hope you found it helpful. It was a pleasure to have a chance to discuss this with you. And please share it with your friends, your families, and members of your community. And I'm going to pass it on to the next speaker. Thank you for your time today. This has really been great and a great program.
Thank you so much, Amy. Wow, you do know how to pack in the information. That was just absolutely remarkable. I love this last slide of yours that shows all of these things. It's also a great segue because we're just about to spend some time with Terrence and Tony Green, as you see in the corner. We won't be able to do a whole day in the life of TNT, but we're gonna take at least 10 minutes in the life of TNT and